When you look at the Swedish healthcare system, you can actually see very distinctly two main periods. One period starting at 1972, when we actually said no to private practice for doctors working in hospitals and having small clinics on their own, and said we need a primary healthcare system where we employ doctors. So it was a move from private to public, and then it gradually moved into more and more of a need-based public system. But something happened then at the early 90s, and that was by influence from other countries, by an ideological shift among many. They started to create markets within. They called it in Swedish names that of the place or the region, but they were actually copied from England because they had introduced these so-called purchase provider systems 10 years earlier than we. Then finally came the big step towards a commercial market, and that was 2009, and it was a conservative government, and they introduced a system that was called a system for choice. But that was of course just a covering up for the real meaning of the change, because it was a system for privatization.
So how has the privatization of healthcare impacted normal Swedish people? It totally depends on who you are. If you are a privileged person, you will be privileged in this system because it is a system that is driven by profit. And you can be a profitable patient if you are quite healthy. If you live in a big city, then you might enjoy a freedom of choice between different local health centers, and maybe you can choose where to go have surgery for your knee. But if you are a manual worker, if you are someone who maybe has a different language than Swedish, or if you are chronically ill and you have big needs, you will notice that the healthcare centers that you approach would not like to have you as a patient because you're not profitable. The promise of private care bringing efficiency, bringing faster care, bringing less waiting times, has only materialized for some patients. Most of the patients get to wait longer, while money is wasted on profitable patients.
I mean, this is a costly system, and for the conservatives it doesn't matter so much if it is costly, if it benefits their privileged groups.
Healthcare in Sweden, in Iceland, in all over Europe and the Western world is underfunded. I think this is something that you fundamentally need to understand, that there is a lack of resources. We live longer lives, so we need more care. We have amazing medical inventions that bring us possibilities to cure illnesses that used to kill us, but makes us maybe chronically ill and dependent upon medication for the rest of our lives. There are lots of reasons why healthcare has become more expensive, and rightly so. So if you do not expand healthcare budgets, you will get problems. And it's not a solution to invite for-profit providers to compete about the resources that are too small to begin with. Because the only thing that will happen in this competition is that they will take the resources for the more privileged people who have small needs, who are therefore very profitable to help, and the people who have larger needs, they will be left behind, they will be further back in the queue.
I think it is difficult to be very hopeful right now about the future in Sweden. I'm afraid that we're moving towards more and more of an American system, even though it is, of course, not saying that it will become like in the US, but this driving forces are somehow similar. And some of them, if you let it go very long, they are almost irreversible because it's so difficult to turn it back. So one should be very early in the trying to prevent this, and we have been very passive politically, or the counterforces have been, and the others have been very successful.
And a serious warning from the Swedish side is if you have an unrestrained privatization, if you do allow not only for profit companies, but for profit corporations, you soon might have the Swedish situation where one of Sweden's largest hospitals, it's not longer owned by the Swedish population, by a French-Australian corporation who are now thinking of selling the hospital to Abu Dhabi. In what way has this brought a freedom of choice to the patients in Sweden? In what way has it enabled the doctors and the nurses working in this hospital to have more influence over their working conditions? Of course it doesn't. And I think an important message for trade unions and for ASI is if you're organizing people who work with their bodies, who have long working hours, who have to work for a long time before finishing school and their pension, they need to ask themselves, will this healthcare be tailored for me? Will it be targeting my needs, my maybe long-term needs, or will funds be diverted to some other people's need? Probably in the city center with people who have comfortable office jobs and who have very small health needs. That's the innovation, that's the efficiency of the private for-profit providers. We should not let them into healthcare.